This is the first of two lectures pertaining to the heart. This is the heart, part 1. Look at the anatomy of the heart first. The heart is about the size of your fist. It's located in the mediastinum. Remember, the mediastinum is between the lungs. It's in the midline between the lungs. It's between the second and fifth rib, intercostal space. Intercostal is the space between ribs. It's on the superior surface of the diaphragm. That means it's above the diaphragm. 2/3 of the heart are to the left of the mid-sternal line. Mid-sternal line would be the line through the midpoint of the sternum. So 2/3 of the heart are to the left of that. So the heart's more on the left than on the right. The heart is anterior to the vertebral column and posterior to the sternum. The apex of the heart points down and to the left at 45 degrees. Here's some pictures to show you that. Here's the mediastinum, the central portion of the thoracic area. The heart's in the middle in the mediastinum. It's posterior to the sternum, which is here. It's anterior to the vertebral column. Here's another picture of the heart. Again, size of fist, and it's primarily to the left of the midsternal. Here's the midsternal line here. It's primarily to the left of the midsternal line, and the apex points toward the left. The heart is basically a pump. Its job is to pump blood throughout the body, but it's really not just a pump. It's two pumps in one. There's two separate circuits of the blood flows through the body. There's a pulmonary circuit and there's a systemic circuit. The pulmonary circuit, or the right-sided circuit, pumps blood from the heart to the lungs, and this is blood that's been through the body already, and it's full of carbon dioxide and it's not very oxygen rich. So that blood is pumped to the lungs, so where it picks up oxygen, and when it releases the carbon dioxide, and then it returns to the heart to go to the rest of the body. And that's where the systemic circuit comes in. The systemic circuit pumps blood that's coming from the lungs, that's been freshly oxygenated from the lungs, and it pumps it out to the rest of the body. So all the body tissues receive oxygen-rich blood and can get rid of their waste products of carbon dioxide, which then goes back to the right side of the heart again, and it repeats the cycle again. This diagram shows the same thing. You have the pulmonary circuit, you have the heart coming from the blue represents oxygen poor blood, the red represents oxygen rich blood. Oxygen poor blood is pumped from the heart to the lungs. In the lungs, the oxygen is exchanged and carbon dioxide is exchanged. So the blood picks up oxygen and releases carbon dioxide out coming from the heart, from the lungs. You have this oxygen-rich blood that then goes back to the heart, where it's then pumped out through the aorta and through all the branches, all the different blood vessels, all the different arteries throughout the body, go throughout the entire body. And in the tissues of the body, there's exchange where the oxygen-rich blood is depleted of oxygen because the tissues are needing the oxygen, but then the tissues get rid of their carbon dioxide back to the bloodstream, and so the oxygen poor blood, which has carbon dioxide in it, comes back to the heart, where it's then pumped back up to the lungs, and the circuit starts all over again. It's going to be important for you to know the flow of blood, the pattern that blood flows through the heart and lungs. First of all, the heart has 4 chambers. There's atrium and ventricles. Atrium are the receiving chambers of the heart. There's right atrium receives blood from the systemic circuit. The left atrium receives blood from the pulmonary circuit. The right ventricle pumps blood through the pulmonary circuit. The left ventricle pumps blood through the systemic circuit. I have some pictures that'll show you these a little bit better here coming up. So we start in the right atrium. This is the blood coming from the superior vena cava and the inferior vena cava that empties into the right atrium. After it enters the atrium, the blood flows down through this valve into the right ventricle. When the right ventricle contracts, it pushes the blood out to the pulmonary pulmonary vein, pulmonary artery, and this goes into the lungs. It goes to the left lung and to the right lung. And then after it comes back from the lung, then the blood returns to the left atrium through these pulmonary arteries, pulmonary veins, and then the blood flows down into the left ventricle, where it's then pumped out to the aorta and goes to the rest of the body. The heart muscle is arranged in a manner so that when the heart contracts, it contracts in a way that it gets more efficiency from the contraction. The contraction starts at the bottom and then squeezes out from the bottom up. This allows a more efficient emptying of the blood from the heart. The name of the muscle of the heart is called the myocardium. Myo meaning muscle and cardium, cardiac. So the term myocardium literally means heart muscle. I mentioned this is just, like I said before, there's two superior atria and two inferior ventricles. The atria are on top, the ventricles are on the bottom. There's a septum in between the atria. It's called the interatrial septum that separates the one atria from the next. And there's an interventricular septum which separates the ventricles. You see the septum here. This just shows some of the features we've been discussing. Here's the right atrium here. This is the superior vena cava. By the way, superior vena cava drains blood from all the tissues that are superior to the diaphragm. Everything above the diaphragm comes to the heart through the superior vena cava. The inferior vena cava drains blood from all the tissues below the diaphragm. But these two drain into the right atrium. Right atrium, from here the blood flows down into the right ventricle. Right ventricle squeezes and it pumps the blood out through this pulmonary trunk, which divides into the left and right pulmonary arteries. And this is, may mention that this is a little bit unusual in that normally you think of arteries as being red and having oxygen-rich blood, and veins are typically referred to as being blue and having oxygen-poor blood. That's true except for these, the heart arteries and veins. This is a pulmonary artery, because the definition of artery is a vessel that takes blood away from the heart. Now, in the systemic system, that's going to be oxygen-rich blood and be red, not blue. But in this blood has been through the body and it's depleted of its oxygen. It hasn't gone to the lungs yet. So on the way to the lungs, this is represented as a blue color, even though it's a pulmonary artery. And then after it leaves the lung, it comes back to these pulmonary veins. Again, veins, normally you think of veins being purple or blue, but in this case, the veins are oxygen-rich, so the red to denote that they have oxygen in them, and it comes back in from the pulmonary veins into the left atrium. Left atrium, the blood flows down to the left ventricle. The ventricle contracts, and it goes up here through this valve here, and it goes underneath the pulmonary trunk and comes out the aorta, and from the aorta it's pumped throughout the whole body. The atria are the receiving chambers. That's where the blood from all over the body comes into the heart initially. The atria is, compared to the ventricle, is small and thin-walled, and there are three veins that empty into the right atrium. There's the superior vena cava, and the inferior vena cava, and the coronary sinus. I mentioned before that superior vena cava drains all the blood above the diaphragm. The inferior vena cava drains the blood from all the tissues below the diaphragm. The coronary sinus drains blood that has been used to supply the heart with blood. And the four pulmonary veins empty into the left atrium. That's what we see here. Four pulmonary veins, these 1, 2, 3, 4, enter into the left atrium. Now the ventricles, compared to the atria, are thicker. The walls are much thicker. These are actual pumps to the heart. The right ventricle pumps blood into the pulmonary trunk, which then splits up and goes to the lungs. The left ventricle pumps blood into the aorta, which is the largest artery in the body. Here's again showing the heart with the major vessels. You have the superior vena cava, inferior vena cava. The blood goes into the left atrium, or the right atrium, and then into the right ventricle, where it's pumped out into the pulmonary trunk, which splits to the left and right pulmonary artery. It returns to the heart by way of the pulmonary veins. There's left pulmonary veins and right pulmonary veins. This goes into the left atrium, which then goes to the left ventricle, which is then pumped through the aorta to the rest of the body. I want to mention the blood flow through the heart goes in a single direction. There's valves in the heart which ensure that the blood goes in a specific direction. A valve is basically a way to ensure the blood does not flow in the opposite direction that it's supposed to. There's two atrioventricular valves. These are valves that are between the atrium and the ventricles. There's a tricuspid valve, which is between the right atrium and the right ventricle, and the mitral valve is between the left atrium and the left ventricle. The mitral valve is also called a bicuspid because it's got formed of two cusps. The tricuspid has three cusps. The chordae tendineae anchor the valves to papillary muscles, and they hold the valve. They hold the valve is in place in a closed position. I'll show you a picture of that. It might make more sense with the picture. Here's our right AV valve, right tricuspid valve. And see, the tricuspid valve allows blood to flow from the atrium down to the ventricle. When the ventricle pumps, it's going to push blood out the pulmonary trunk, but if the valve wasn't here, it would push blood back up into the atrium. Well, we don't want it to do that. We don't want to fill the atrium with blood that's already been in the atrium. So these close up. It's almost like a parachute. How a parachute collects air and it billows up. Well, when the blood pressure in the ventricle increases from the contraction, these valves billow up and blocks the entry of blood into the atrium. So it ensures that blood to leave the ventricle can only go out the pulmonary trunk. And there's valves here, semilunar valves, from the pulmonary semilunar valves, which ensure that blood can flow outward, but then it blocks blood from flowing back in. So once blood leaves a certain chamber, you don't want it to backflow into that chamber. It's the same thing on the left side of the heart, from the left atrium. Blood flows down past these mitral valve or the bicuspid valve. When the left ventricle contracts, it's going to close up these valves to prevent the blood from going into the atrium, and then allows the blood to be pumped out the aorta to the rest of the body. I don't want to keep beating a dead horse, but I just want to go over this to make sure you understand the flow of blood. This diagram basically goes through each of what we just said, kind of puts it one step at a time. You can read that as well as I can read it. But it's important to know the route that the blood takes through the heart and through all the four ventricles and through the two atrium and two ventricles, through all four chambers of the heart. Now I mentioned a while ago this aortic semilunar valve and pulmonary semilunar valve. These prevent backflow into the ventricles. When the ventricles contract and then relax, you don't want the blood to flow backwards into the ventricles. These semilunar valves prevent that blood from flowing back into the ventricles. Here's semilunar valves. This would be for the pulmonary trunk, how the blood flows this way. But then when blood after the contraction is occurred, then the blood would want to go backwards, but it's not. It can't go backwards because then these semilunar valves close and block the blood from going back down into the ventricle. So again, this just ensures one-way flow of blood. The blood is to flow from inner ventricle to out. It doesn't want to flow the opposite direction. This is just another view of the valves. This is the mitral valve or bicuspid valve. See, it's got two cusps, 1, 2, as opposed to the tricuspid valve, which has 3 cusps, 1, 2, 3, 3 sections. The semilunar valves each have 3 sections, 3 cusps. The aortic semilunar valve and the pulmonary semilunar valve. So again, the pulmonary circuit goes from the right atrium, goes down across the tricuspid valve into the right ventricle. From the right ventricle, blood is pumped through the pulmonary semilunar valve, which then goes into the pulmonary trunk, splits into the pulmonary arteries, and then goes to the lungs. From the lungs, the blood returns to the pulmonary veins into the left atrium. From the left atrium, the blood is then pumped, or blood flows past the mitral valve into the left ventricle. The left ventricle contracts, pumping the blood through the aortic semilunar valve into the aorta. From the aorta, blood flows to all the systemic circulation and eventually makes its way back to the right atrium again, and the cycle repeats itself. These next few slides basically show the exact same thing. I'm not going to read these because you can read as good as I can, and it's basically repetition of what I've already said. But this just shows a different order that blood flows through the heart chamber. Blood flows to the right atrium. Right atrium flows into the right ventricle. Right ventricle contracts, pushing blood up through the pulmonary trunk. Go out the pulmonary trunk. The valves close behind it, so the blood doesn't back up into the ventricle. From the pulmonary trunk, the blood goes into the capillaries of the lungs, where picks up oxygen and releases carbon dioxide. So then coming from the lungs is the oxygen-rich blood, which then comes in the heart by way of the 4 pulmonary veins. There's 2 on the left and 2 on the right, but the 4 pulmonary veins empty into the left atrium. Blood is in the left atrium, then shows there the blood going into the left atrium here from the pulmonary veins. From the left atrium, blood flows down to the left ventricle. The ventricle contracts, which pumps blood through the aorta and out to the rest of the body. Once it's through the body, it goes through the different capillaries and tissues throughout the whole body, where the oxygen is used up by the tissues, and the tissues dump their carbon dioxide into the bloodstream, so it goes back to the lung and back to the heart and lungs to repeat the cycle over. This shows all of this in one picture. Now, if you look at you might remember from the histology, chapter 4, when we looked at the cardiac cells, how these cardiac cells have striations, and they have these intercalated discs. Intercalated discs are junctions between the cells of the heart. Desmosomes prevent cells from separating during contraction. Here's desmosomes here. Desmosomes are like rivets that fasten one heart cell to the next, so that when they contract, the heart cells don't split apart from each other. They stay close together. Gap junctions are there to allow ions to pass from cell to cell. What this does, this allows the heart to function as a single unit. And the heart is made up of many heart muscle cells. But when they contract, they don't contract independently. They contract in a coordinated manner, so that it's like the whole heart contracts as one unit as opposed to individual cells contracting. This is to get a more efficient propulsion of blood from the heart to the lungs, to the systemic portion of the body. This table just shows some of the differences and similarities between skeletal muscle and cardiac muscle. Remember, skeletal muscle is striated, the long cylindrical shape, multiple nuclei. Cardiac muscle striated also, it's short and it's branched, 1 or 2 nuclei per cell. The skeletal muscle does not have gap junctions, whereas the cardiac muscle does have gap junctions. Remember, the skeletal muscle does not contract as an individual unit. The muscle fibers must be stimulated individually. So when you want to contract your biceps, all the muscles of the biceps don't contract at the same time. It depends on how much power is needed, but certain muscle cells are recruited to perform the function that's necessary for that, to pick up that object that you might be picking up in the hand. Whereas in the heart, there's gap junctions that create a functional system, which basically makes the heart beat as a functional unit. T-tubules are abundant in skeletal muscle. They're fewer in cardiac muscle. Sarcoplasmic reticulum is elaborate and has terminal cisterns. Remember the triads from the skeletal muscle? There's no terminal cisternae in the cardiac muscle. Calcium is used for contraction in the skeletal muscle. It comes from the sarcoplasmic reticulum only. In the heart, it comes from the sarcoplasmic reticulum and also from extracellular fluid. Pacemaker cells are not present in the skeletal muscle, but are present in the cardiac muscle. On the next lecture, I'll go into what pacemaker cells are in more detail. Tetanus is when all the muscles contract, and that's possible in a skeletal muscle. It's not possible in the cardiac muscle. Skeletal muscles use aerobic and anaerobic means of energy, whereas the heart muscle uses aerobic only. Aerobic meaning oxygen based.